Hello, my name is Dr. Chad Swanson. I'm a physician with a passion for global health, and I'm convinced that transformational change is needed in the way that we approach health around the world. About 12 years ago, I came to the conclusion that too many people suffer and die needlessly. So I decided to do some humanitarian work in Mozambique. I knew the numbers. I knew that millions suffered and died from AIDS, diarrhea, malaria, and other diseases, but I hadn't witnessed the suffering firsthand. On one of those trips, I had a simple goal. I needed to really feel and understand how people suffer and die on a personal level. I was working with some community health workers in a Mozambican village, and we went to an abandoned restaurant. It had a dirt floor and there were no lights, windows, or electricity. In the corner of the room, I saw a young lady, probably in her 20s, who was obviously very sick. She was breathing fast and was extremely thin. She was close to dying. At that moment, I realized in a very personal way that she, a young woman with family, friends, and dreams, was really suffering. But I really didn't know what to do. I walked over to her and shook her hand and said in the best broken Portuguese I could muster, "Are you sick?" She of course said yes. And then I did something that still haunts me today. I walked away. And I walked away because I knew that there was nothing that I could do for her at that point in time. You see, in my previous trips to Mozambique, I had rushed patients to the hospital in jeeps and tried to relieve their suffering through emergency treatments. But my efforts were too often in vain. I came to the conclusion that global health approaches need to consider more than one patient at a given point in time. There are serious underlying causes of poor health around the world that extend beyond the medical care that is delivered in hospitals. These causes are determined by larger issues. Things like assumptions we make about gender, economies, cultures, and the way we interact as people and organizations. As I walked away from that lady in Mozambique, I committed myself to spending the rest of my life addressing those systems-level causes of poor health and needless suffering. Despite tremendous successes, I recognize the inadequacy of the way we have approached health historically. For the last 150 years, we have thought of health improvement largely from the perspective of one disease, or one patient, or one policy, or one program at a time. The eradication of smallpox is a great example of this. We identified a disease that was killing millions. We developed a vaccine to address that disease, and then we delivered it, and in the late 1970s, we eradicated smallpox. While there have been phenomenal results with this approach, we need to complement it with a new approach called systems thinking. Systems thinking is a unique and transformational approach to health improvement for 4 key reasons. First, we consider how people, communities, and organizations with differing goals and interests can come together to accomplish what we as a society really want. Things like population health improvement, increased capacity, efficiency, and equity. Second, we consider more than just one disease or patient or program at a time by looking at the big picture, thereby minimizing unintended consequences. Third, we challenge basic assumptions that we all have about what health is and how it is delivered. Fourth, we continually reassess and learn from our experience at a local level, allowing for adaptation to address new challenges. Because the world is changing faster than ever. This can result in solutions that we may never have thought of. This approach to health improvement might seem obvious, but systems thinking concepts aren't being applied enough. When rigid plans are developed in cities like Geneva or Washington and are then implemented in places like Ghana and Mozambique, too often local context and culture are not sufficiently considered. Perhaps most importantly, there are not enough opportunities for locals and experts to learn together about the best ways to improve health in unique settings. We need to change the way we approach every aspect of health to incorporate more systems thinking. We need a systems thinking revolution in health practice, policy, research, and education. I've recently connected with a number of health professionals, students, and concerned citizens from around the world to advocate for more systems thinking in global health. Thanks to support from the Doris Charitable Foundation's African Health Initiative, we have formed a group called Systems Thinking for Capacity and Health, and we hope you'll join us for the sake of the Mozambican woman in the corner and millions like her. Thank you.